Hi guys. So for the benefit of those who are not acquainted with certain medical terms, I'll take it through for this video. Then for our next video, we are going to start with our medical conditions. I will be starting with that will be helpful for students, for clients, for healthcare practitioners, whoever comes across it, so that when your healthcare practitioner is talking, you don't just stay out of the box. So we have pruritus. Pruritus is a medical term that is used for itching. Now, when you experience itching, it's called pruritus. We have edema. Edema is the accumulation of fluid in our body. It can be any body parts. We have pedal edema. Pedal edema is accumulation of fluid in your lower extremities, that's your legs. We also have pregnancy-induced edema. This edema does not come as a result of a medical condition, rather it occurs as a result of pregnancy. So there's accumulation of fluid in your face, in your hands, in your legs. One will be looking at the cyanus, a bluish coloration of the body, the lips, the fingers, and the toes. Then another term we'll be looking at aneurysm. Now, what's aneurysm? Aneurysm is the bulging or a balloon-like blood vessel. When the walls of the blood vessel bulges, it's called what? Aneurysm. Aneurysm can result to coronary artery disease, so it's one of the risk factors. Then we also have what we call angina pectoris. Angina pectoris is a medical term for chest pain, and this is as a result of low oxygen supply to the heart. So when the heart has low oxygen supply, you have what? Angina pectoris. It's a sign and symptom of myocardial ischemia. The medical term we'll be using is sputum. Sputum is that mucus we bring out from our lungs. One is hypertension. So when they say you're having hypertension, it means you have low blood pressure. And when we have hypertension, when it's hyper, meaning it's up, so it means you have high blood pressure. And then we also have what we call orthostatic hypertension. This occurs as a result from standing. When there's hypertension when standing, probably you were lying down and you decide to stand up, it's what we call orthostatic hypertension. It's hypertension that occurs upon what? Standing. Also, we're talking about hemoptysis. Hemoptysis is a medical term for coughing up blood. When you cough and this cough is accompanied by blood, it is called hemoptysis. Another medical term we'll be looking at is cyst. Now, there's a difference between cyst and edema. So cyst is a medical term for the accumulation of fluid, air, blood, or pus. So it has to do with accumulation of anything in our body. There's any accumulation of materials, either pus, blood, air, it can lead to cyst, the formation of cyst. So fluid is like a closed sac-like pocket that either contains fluid, it can be air, it can be blood, it can be pus. So that's cyst. We have different kinds of cysts. We have ovarian cyst, we have cysts in the body. It depends on the location of this cyst. Now, another one we're talking about is arthritis. Arthritis is also known as inflammation of the joints as a result of aging. The more you advance in age, the more you are prone to arthritis. Another term we'll be looking at is ischemia. Ischemia occurs as a result of lack of blood supply to tissues. So it can be myocardial ischemia. When is myocardial ischemia? It's as a result of low oxygen supply to the heart muscles. So another anorexia nervosa is self-induced starvation due to fear of getting fat. Now, this has to do with our mental health. So, when you have this fear of getting fat, obviously, you would want to eat, right? So, that's what we call anorexia nervosa. We also have bulimia nervosa. Bulimia nervosa is when it's a medical term for self-induced vomiting. Now, when you finish eating, you self-induced vomiting because of severe fear of getting fat. That's what we call bulimia nervosa. Another thing I will talk about is emetics. What is emetics? Emetics is a medical term for vomiting. So just say, I give her antiemetics, that's anti-vomiting drugs. Or she's having emetics, that's so guys. That is all we're talking about for today. Like and subscribe to my channel. Share this video if you find it very helpful, and don't forget to drop your questions or comments in the comment section. Just click on the notification button for further updates. So next week we'll be talking about disease of the cardiovascular system. I'll take you through the causes, the description, the signs and symptoms, the pathophysiology, the treatment and prevention of these diseases. So guys, yes, see you in the next video. Bye.